My name is Dr. Kusuma. I'm the medical director and the plastic surgeon here at Surya Plastic Surgery in South Florida. My practice now essentially is focused on cosmetic surgery of the face, cosmetic surgery of the breast, and reconstructive surgery of the nose, and cosmetic surgery of the nose. Those are the areas that I basically have focused on. We offer comprehensive care, essentially. There's not much that we cannot tackle or handle. If we don't have the solutions, we will seek solutions for the patient. We make sure that everybody in the office knows about every patient that walks through the door. That is the way we deliver care. You are not just a number to us, you're not just a breast augmentation to us, you're not just a facelift to us, you're a person to us. And so when somebody comes in, we know their name.
Our goal is to make sure that the patient feels very comfortable. We want them to know that we're going to be here for them, no matter how small or how big the procedure is going to be. Our weekly meetings are to make sure that our patients are receiving quality care. We go over the whole week's schedule and review every single individual patients to make sure that they're receiving the care that we feel that is necessary for them. We want to provide optimum care and long-term results. So they will probably go to the spa and have skin care. They will come to me for non-invasive procedures, whether it be lasers or injectables. And then they would see Dr. Kusuma for any surgical procedures.
We want to be a lifetime center, and I want to be a lifetime doctor, not a one-time center and a one-time doctor.
Hi, my name is Chastity. I'm 40 years old, mother of 2, and about 14 years ago, I lost a lot of weight. So I had been dealing with, my breast being very saggy and unhappy with what I saw in the mirror. So my 40th birthday was rolling around and I decided to give myself a birthday present. So I started looking around for different plastic surgeons. I had made a couple of appointments and Dr. Kusuma's was the first one I came to see. He answered everything more so than, the questions that I had. He even gave me answers to, questions that, oh yeah, I forgot about that. Even the second time around, I had forgotten more questions. And I just decided to cancel the other 2 appointments because I just felt like this was the right place. They made me feel very comfortable because while I was searching, to get this done, even before with all the other surgeons that I never even got to see, I was very nervous. I wasn't sure if I wanted to get this done. I wasn't, sure what the outcome was going to be, if I was going to be happy. But coming here and having the first consultation and a second consultation before I even got to see anybody else, it was, the perfect place to be. After the procedure was over, my nurse Tanya and the girls here are wonderful. They call you to see if you're okay. They call you for anything. I had a question about something and you just pick up the phone and you call here and they answer it right away. After being here and seeing how wonderful they are and how great this facility is, and Dr. Kusuma and his talents, I would so recommend anybody to come here. I would even come back myself for maybe other procedures that I'm thinking of having done.
My name is Rhonda. I live in Plantation. I'm from New York originally, but I've been down here since I was 9. My secret in my life is that I love 2 men. One of them I'm in love with, who happens to be my husband, and I knew less than 24 hours I would marry him. My other love is Dr. K, and I knew within the hour that I was not in love with him, but I loved him. I originally came here to see Dr. Kusuma about having my neck done. I used to constantly pull it back and walk around for about 10 years like that, and finally I got the courage to come here. He was very, very kind, took the time completely, never made me felt like I was being rushed, explained to me everything in detail. He was more concerned about my health than just taking in the money. Well, I love the way I look. I mean, compared to, I think even when I was in my 20s, I think I look better now being 66. But I definitely have referred people to Dr. Kusuma. I brought my friends in, and I just think he's marvelous. So I still feel the same way about him. I'm recommending anyone and everyone that wants to have something done at least to come here for a consult. And I feel very strongly, and if I have anything else done, I will definitely come here. He's the only doctor that I will let operate on me.
Hi, I'm Joan, and I'm originally from Wilmington, Delaware. I had my neck done, I had my eyelids done, and I had fillers put in my cheeks. And I am very, very happy with the results. I looked in the mirror every morning and I said to myself, I can't go through the rest of my life with this neck. I have to fix my neck. Well, I would recommend them mainly because of the doctor. I thought he was fabulous. He's just terrific. And he will spend as much time with you explaining the procedure. He will go over exactly what he's going to do if you want to hear. And he will really advise you if you should, what you should do. And I had tremendous confidence in him. I really, really did. So I'm coming just for the doctor. I mean, the staff is all nice, but the doctor is really the one that's doing the procedure. And to me, that was the most important thing. I'm just very, very pleased with everything that occurred here from my first conversations with the doctor, and I did come back quite a few times before I decided. I was very happy with him. The staff was all very, very nice. The day I had the procedure done, the anesthesiologist came in and talked to me. The nurse was wonderful. She came in beforehand. They were very friendly. They introduced themselves. They told me not to worry. They told me when they would call my husband after I was completely recovered and not to worry, everything would be fine. And they were just terrific. They really, really were.
I'm Lisa and I'm from South Florida. I was referred to Syria by a friend of mine. I came for a breast augmentation with a lift. Everyone here and the experience was amazing. Everyone cares so much and is just so personable with you and treats you like they really care, that you're not just another patient. I was nervous before my consultation, but after my consultation walking out, I was very confident in the doctor I was choosing. I just knew everything that was going on, and I just felt like it was the right choice. I would do it all over again.
Originally, I had heard about Dr. Kusuma and went to him because I had some Mohs surgery done on both my chest and on my face, and he was asked to close the cuts to stitch them and also to do a biopsy on my face since it was my face. So that was my first introduction to him, and then once those procedures were done, I started talking to him about my face in general. I've been thinking about doing something for quite a long time. I've actually gone to 2 other doctors for consultations. I wanted to look better than I had been. My mother had aged prematurely, and I was kind of following in the same footsteps in that respect, so I wanted to perhaps prevent any more aging, at least at this stage of the game, look a little better than I had. And it just was a thought process. My consultation was after he had been doing a follow-up with my Mohs surgery procedures, and we just started talking, and I started asking him some questions, and so he spent time answering those questions, giving me a sense of the types of procedures that were available, what the procedures themselves entailed, the length of recovery, and what options I would have. I'm completely satisfied with what Dr. Kusuma did. I'm very happy that I made the decision to do it. I would suggest other people consider it if they have been thinking about it. I would definitely recommend Dr. Kusuma.
My name is Kimberly Bisogno, and I'm a nurse practitioner at Surya Plastic Surgery. Here at Surya Plastic Surgery, I have over 22 years experience of lasers, and I can use a combination of lasers to improve what you're looking for, whether it be skin coloration, skin texture, skin vascularity. We have all the lasers that we could use to improve what you're looking for. Basically, when a patient comes in, and there are several types of fillers and several types of volumizer, it depends on the patient's needs or wants. The patients that come to see me that have injectables, they also have the option to see Dr. Kusuma if what I have done for them, I've maximized the results that I could give them. We look at you as an individual, what your individual needs are, and we could use a combination of products or a combination of lasers. So our plan for them is geared towards their needs and also their lifestyle, which is very important to them because they don't want it to interrupt whether it be their work or their personal lives. And we could gear that plan towards that need.
So my name is Tanya. I've been working here for about 3 years as plastic surgery, and I'm a surgical technologist. After I had my child, that's when I really noticed that I wanted my breast done, and I started working here. I was very fortunate to meet Dr. Kusuma over at Westside Hospital in 2011. And I started working with him then, and then I got my breast done in 2012 with Dr. Kusuma. Well, patients that come in that want a breast augmentation are normally concerned about size, what kind of implant they want, whether they want saline or silicone, where the incision's gonna be, their post-op care, when they can start working out, concerned about their cleavage, if they're gonna be narrow or not, and any risk that they might have with anesthesia, where would the surgery be done, things like that. Well, I'm glad, first of all, that I did have this experience because it's hard for you to interact with someone if you've never had this procedure done. Fortunately for me, I did, so I can tell them exactly about my experience, what I did, what I didn't do. I explained to them that not everyone's the same with their post-op. Like some might have more discomfort than others. My pain tolerance is a lot higher. I did have a baby, it's different. A lot of the young girls haven't. I explained to them about working out. I work out myself, so I explained to them, what they can and cannot do. I can explain to them what to expect. If you really haven't had that done, you don't expect to know everything by feeling it. Here at Surya Plastic Surgery, what we do is we have a lifelong-term relationship with our patients. We always keep in touch. We become basically a family here at Surya.
My name is PERRI. I'm from Syracuse, New York. I'm 55 years old. I've been a medical assistant for the last 30 years. I had my upper eyelids done because I was starting to feel tired at the end of the day. I had some loose, saggy skin there. It's now made me feel wide awake, and I'm happy with the results. I had my fillers done because you lose volume as you get older, and I had a lot of lines, small lines around my eyes and my upper lip. Everyone's not sure what I had done, but they know that I look more refreshed and youthful, and I'm really happy that I did it here. I love that I can come to one place, and I love Dr. Kusuma because he really is an expert in all of those things. I was a little concerned initially because sometimes they stick to just dermal fillers or surgery, but he's fantastic at all of them. From the staff to the doctor, they really, really are wonderful. They're honest. They're genuine in what you need. If you want to do something to better yourself or feel more refreshed. In the past, I've worked for several dermatologists. I've never ever seen work such as Dr. Kusuma's. His results just speak for themselves.
My name is Carrie, and I'm from Fort Lauderdale, Florida. So I came in initially I had a breast augmentation in the past. I had implants, and I wanted to get a full lift done and new implants put in. So I ended up doing that, and I got an eyelid lift, and I also got a mini tummy tuck. Yeah, it's always intimidating meeting, a new physician and being in those circumstances where you're talking about your flaws. He made me feel very comfortable. We spent about an hour and 15 minutes together. One thing that I did like is he would face me to the mirror and he'd say, "What do you see?" And he wanted to compare how I saw myself with what he saw. And he did that repetitively throughout the entire time, and he would then compare it and let me know what he thought, so that he could understand what I wanted as a result and how I saw myself and my image. And that really struck me. That was something that I thought was so unique in his approach. Dr. Kusuma, I mean, he made me feel very comfortable, but his staff I can't say enough about. You walk in here and it's like they've known you forever. You know, they greet you by name, they are aware of what you're here for. Their professionalism is unmatched in my eyes. I spend a lot of time in, you know, medical situations, and they're very impressive. I really didn't have any second thoughts on trusting him with the procedures. So I would definitely come back to him. There would be no reason why I wouldn't. And the staff, like I said, is just the cherry on top.
My name is Rebecca, and I've been specializing in permanent cosmetics for the last 16 years in eyebrows, eyeliner, lip liner with blending to enhance a woman's natural beauty. I also do scar camouflaging and areola restoration. Permanent cosmetics is wonderful for any person who is athletic, who may be out in the sun, in situations where they can't apply makeup. It is wonderful for the professional who really doesn't have time to reapply cosmetics during their workday. Wonderful for nurses who start the job very early in the morning. It's wonderful for a person who might have allergies, who cannot tolerate conventional type cosmetics. It is for also the person who does not have the ability to apply makeup. Say they have maybe MS or Parkinson's, where they have a shake in their hands, or they are losing their vision. So I can apply their makeup where it is professional, beautiful looking, and does not smear or come off. Well, patients come to me for many different reasons, and first of all, when they first come, they may be a little intimidated because it is applying cosmetics that do last a lifetime. It is permanent. I talk to them about shape, about appropriate color. Everybody's bone structure is different, so it is not one size fits all. Well, psorioplastic surgery is a one-stop shop as far as beauty is concerned and anti-aging, with our professional skincare with Loose. Kim does the fillers, and Dr. Kusuma does the fillers to help enhance a woman's features where their collagen is depleting in their skin. Dr. Kusuma does several different types of cosmetic surgery to enhance a woman's body or facial features. The staff is all very friendly and makes a patient feel comfortable and at home.
When I think about facial rejuvenation, I think of it in a very comprehensive manner. Facial rejuvenation incorporates surgery, it incorporates skin improvements such as resurfacing with lasers or chemicals. It also involves adding or subtracting volume or fullness to the face depending on what the person's face looks like. So as a surgeon, as a plastic surgeon that does a lot of comprehensive facial rejuvenation work, I utilize all of them as I see fit in a patient's plan of care, for example. So many times we do surgery where we take care of the lower face, neck in surgical ways, and then we rejuvenate the skin's quality by doing laser resurfacing at the same time. And we also add and subtract volume depending on the need in the operating room all at one time. So we try to build long-term care plans, not a one-shot care plan. So when I take somebody under my wing to take care of them, I want to impress upon them that this is something that you're investing time and resources, and let me help you maintain this for a lifetime. And facelifts these days come in many forms and shapes and sizes. Many times people come and ask me, Doc, I've read about lifestyle lift. Doc, I've read about this quick lift or lunchtime lift. What is that? How do I decide what I need? Well, it is not your job to decide. It is my job to help you decide. You cannot know what you need unless we talk about it. This is not an easy decision to make, but it is my job to make it easy for you. It's a very personal decision. It's a very difficult decision to make. And it's very nerve-wracking, frankly to say, for patients to make, because you're essentially taking you as a person and putting your faith and trust in me. And that is a solemn trust that I can never violate. And we take that extremely seriously. This is not just about money for us, making a financial decision. This is about doing it because this is what we love to do.
My name is Marion Gentles. I live in Coral Springs, Florida, originally from Kingston, Jamaica. I am a nurse. I love taking care of myself, and I love taking care of people. I came across plastic surgery through Dr. Mayer. His office was on Oakland Park, and that's where I was. I've been going to them since 1997. And I fell in love with the way they treat me, so I continue to go there. When Kim located here, because she's so gentle, when she do the injectables, I follow her here. The artificial treatment that I had in reference to my nose, my nose was flat. I did not have a nose bridge, and I did not like my profile. I came to Kim one day and said, I saw this thing on the doctor show, and I want it now. And she was like, I have keloid skin, so I cannot really operate it on. So I said to her, please build up my nose bridge. I will, love you for the rest of your life. And she was like, okay, I have something that I can put in to build up your nose bridge. And she did the injectables, did a skin test, and did the injectable for 6 months, and here I am. I felt like I got a surgical treatment with a non-invasive. It was not painful at all. It was no time take off from work. It was like I went to work in the morning, in the afternoon I came to plastic surgery and came inject and went back to work. I would never go anywhere else. I recommend to everyone, all my friends that I recommend, they're happy that I can come under one roof and get everything that I want. Not only that, they just care about how they treat their clients or their patient. They're very caring, very considerate. It's home, for me, it's home away from home.
My name is JESSERUM. I'm a medical esthetician. I've been in the cosmetic business for 10 years. Now I'm Dr. Kusuma's skincare specialist and spa manager. Well, in general, I am passionate about skincare. I have a medical clinical approach. When I see a skincare, when I see a patient, I can identify their conditions and their needs and work with them to improve every aspect of any medical condition or skin condition they may have. The most common conditions that we see are going to be acne, of course. There's going to be also melasma. We treat that. We have products that help, and treatment does help improve uneven pigmentation. With that also, we have being in Florida, a lot of premature aging and a lot of uneven pigmentation and sun-damaged skin. So here at the spa, we have all the techniques and all the technology available to help people improve those conditions. At Surya Professional Aesthetics, we analyze individually each of our patients' skincare needs, and based on that, we customize their skincare routines. So each patient is going to have their personalized skincare treatment, so it can help improve their specific need. At Surya Professional Aesthetics, we have all the non-invasive and superficial treatments that a person may need in the event that they need something a little bit more aggressive or a little bit more corrective. We also have here the advantage of providing the laser services, injectable services, all the rejuvenating new techniques that are in the market. We all provide them here.
I was a slow healer, and I had, because of that, obviously a slow recovery. But I knew what to expect. He always was there for me. Not only him, his amazing team, Claudia, Luz, that I adore, also Lisa, they were always there for me. And even I called him on the weekend, and many times. And he always answered with kind words and reassurance. and I feel blessed that I choose him to do my procedure, and I know that I will be back for many more, and I already recommend him to all my friends and family. And I want to thank Dr. Kusuma for being really the best.
Yeah. In my practice, I focus on two main areas, the face and the breast. The breast part of it is also very comprehensive because breasts require a lot of thought to create a proper look. So I, as a surgeon, have to decide many things for the patient or help them decide what type of implants to use, where to put them, what size to use, what texture of implants to use, why we use this. Does the operation have to be done in one setting or maybe it's in a staged manner? What is the type of scarring that you can expect if there's anything like that? Why scars may or may not be good? How do you hide the scars? How do you think of it long term? And how do you follow up with it long term? So when you do breast surgery, it's not a simple decision. It shouldn't be a simple decision, and the patient can never know or should not be able to know what kind of decision to make, because that decision requires a lot of engagement and discussion with the surgeon. The judgment of what implant and what size to choose is more important to me than actually putting it in. I'm not de-emphasizing the fact that the technical aspects of it have to be done very precisely, meticulously also. But that is upon me to do, which I've trained for years to do, and I'm every day getting better at it. But the judgment and the decision making and preparing a patient and the family and walking them through that before and after photograph, that is really where most of the work is done. That is what I want to make sure that my patients understand, is that we are here for you through that process. We're going to hold your hand through that entire process.
My name is Irene Rappi. I live in Boca Raton, Florida, and I'm a real estate agent. I broke my nose when I was 6 years old in a bike accident, and I always had certain insecurities with it, as long as psychological trauma from the fall, and I just wanted my nose to go back to normal. When I came in for the consultation, Dr. Kusuma first asked me what I didn't like about my nose and how I would like my nose to look like. And then, yes, they took a number of pictures from different angles. And that's about it. My rhinoplasty was a very simple one, so there was no need for like markings or like measurements or any of that. The day of the procedure, I came in very early in the morning. I was very nervous. The staff and Dr. Kusuma reassured me that everything was going to go great. He walked me through the procedure. Then they walked me into the room. Shortly after that, I don't remember much. When I woke up, I was pretty out of it. The anesthesia still hadn't worn off, so I don't really remember much. I wasn't in pain or anything. They sent me home with some pain pills, which I only used for the first day. After that, it was minimal discomfort, and here I am 20 days later. No one can even tell I had a rhinoplasty.
I'm SHEILA, and I am originally from New York, and I have been in Florida since 1985. I had my neck done and a reconstruction of my nose, which he did first. I have such confidence in the girls and the doctor that I was not nervous. After the procedure, it's uncomfortable, but it's to be expected, like family when you come. So friendly, warm, interested in, how you feel. It's a pleasure to come here. Absolutely, I would do something if need be. This is my birthday, Christmas, anniversary presents. This is what I get.
My name is Denise. I live in Fort Lauderdale, Florida, and I'm in the yachting industry. I had breast implants for the first time in 1989, and in December of 2013, I had a rupture. When I came in for the first consultation, I brought my records with me, the films, and he looked at them and said, It needs to come out. It is not an emergency surgery, but we're doing it next month. I said, fine. During the consultation, it was during follow-up visits after the removal, before the replacement, I said, if we could fix one more thing, what would you suggest? And Dr. Kusuma said, the neck. I said, fine. And I hemmed and hawed about it because I thought maybe the eyes, and I kept hemming and hawing, finally decided, and I looked in the mirror and said, it's gonna be the neck. I think the fact that it's what I call one-stop shopping is fabulous, and you see the same people, it's a good atmosphere, it isn't constant changeover, you're not having to adjust to new people and them to you each time. And again, the safety that Dr. Kusuma stresses, that's right down the line with everybody. So to me, that was one of the most important things, and that's why I've told some of my friends about it. I've given out like 6 cards.
Here at Surya Plastic Surgery, we're also building a true laser center of excellence, because I want to convey to patients and to the general community at large is that lasers are not magical machines that do everything. Lasers are very specific machines that do very specific things. So I have to have access to many different types of laser modalities to target the specific things that patients have on their faces or their bodies, for example. Many people come to us with brown spots, red spots, blemishes, age spots, sun-damaged skin, wrinkles, fine lines, deep lines, all kinds of different things. And so as a comprehensive facial surgeon, I have to have access to a lot of the machines, which are lasers, to target specifically each one of those things. Not everybody has every one of those things. So I can't say I'll do a laser procedure on you. I got to say I'll take care of your skin. And to take care of your skin, I have to use all of these things to get you there. And I will help you decide which of these combination products you should use and why. And what kind of outcomes to expect from each of these products, the longevity of it, the safety of it, and also lasers are the same way. If you have these things, I oftentimes use 2 or 3 different lasers at one setting, because I want to target your wrinkles, for example, and the red spots and the brown spots all at one time. So one laser can't do all those things. I have to use a combination of them. And there's limitations to these things. Lasers will not take care of your turkey gobbler neck if you have one. I have to do surgery for that. So I can use surgery, I can use the fillers, I can use the lasers, all of this at one time. And when it's done, we circle back and say, to maintain that, I'll have you see, my nurse practitioner Kim, to do some minor touch-ups here and there. And to keep your skin as healthy as possible, I'll have you see Luz, my esthetician, to do topical skincare products as an ongoing regimen, as facials as an ongoing regimen. And when you're at a point where you need my services again, you circle back to me again. So we try to keep this loop of care or a coordination of care so that we are addressing everything that we can address for you in our office.